The dentist will see you now. This is wisdom teeth extraction. I'm pretty sure. Did I turn my computer audio on? No, I didn't.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today.
Okay.
A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth.
Okay.
X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities.
Don't touch me, I'm sterile.
Let's get started. First, insert a positioner into the patient's mouth.
Sorry, I need to readjust my doctor mask. I'm social distancing. Put this here. I remember the last time I had to get this done.
Position the X-ray cylinder where indicated.
And stick it right in your eyes.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure.
Beep, beep.
I couldn't have done it better myself. I'll have my assistant finish up the rest of the X-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots, and now that all of the X-rays have been completed, we can extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have 2 or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic. To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain the needle may cause.
Okay. Numb up them gums. Oh, the
Next,
way the tongue
we can
moves.
inject the local anesthetic.
Ugh,
The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
Oh, needles. I hate needles. Here we go. There we go.
And now we'll give our patient
Contrary to
a few
popular
minutes to
belief,
become
most dentists
completely
use
numb.
lidocaine, not novocaine. You like jazz?
Great. The patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
Uh-oh. Is this a tool that I'm going to be raising your teeth up with? Or your tooth? Okay. Ugh.
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
Why not just use pliers? Like some industrial strength pliers.
Now clean the area using a surgical suction.
That is not really as
To
bloody.
check the area for any bony matter or tooth structure that may be left in the socket.
That is a lot less bloody than I intended, to be honest. Or that I thought it was going to be. I hate that sound. I had, when I went to the dentist last, they rinsed my mouth. And they did the that suction thing, and I hate the sound of that and the way it feels. Click where indicated. I keep messing with my mask.
Everything looks great, but we're not done yet.
Stop moving
Our
your tongue.
patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
There you go.
Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth.
In their mouth. And there we go.
When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity. Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days,
Okay.
avoiding sodas and the use of a straw, and gently rinsing your mouth out with warm salt water to help relieve pain after the first
My
24
teeth feel
hours.
weird now.
It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area.
Don't smoke.
And that's a wisdom tooth extraction. You did great. If you're up to it, why not try another procedure on SurgerySquad.com?
Why not do some virtual dental crown placement? Here we go. Mask on. Patient's vitals good. Okay.
Welcome to Surgery Squad's virtual dental
This is a lot of
crown.
steps.
I'm Dr. Jeff, and I'll be
Dr.
assisting
Jeff.
you with this procedure today. A dental
Ah.
crown is a tooth-shaped cap that is used not only to restore the
What do you do to
strength
your
and
teeth?
functionality of a tooth,
Should
but
be
can
one to
also
talk, but what do you do
improve
with your
its
teeth?
overall appearance. Before we begin, let's review the types of crowns used in dentistry.
Got a mustache going.
First up, temporary crowns. Temporary crowns are placed over a patient's tooth while they wait for their permanent crown. They're usually prefabricated and made of plastic or stainless steel. A patient's permanent crown can be all metal, porcelain fused to metal, all porcelain, or all ceramic, each with their own advantages and disadvantages. Click on the different types of crowns to learn more about them. The metals that are used in all metal crowns include gold, palladium, nickel, or chromium alloys. While all metal crowns require less tooth structure to be removed and have, unlike metal crowns, porcelain fused to metal crowns can be matched to the color of your teeth. All porcelain or all ceramic crowns have the closest appearance of a natural tooth and may be ideal for those with metal allergies. Our patient came in today with a broken tooth, courtesy of a freak softball accident, and we get the rewarding task of placing a crown in. If you
The
haven't
rewarding
noticed
task?
already, it's one of their lower front teeth, tooth 23. Let's review what we're going to do today.
And that's another thing they would
To
do. They
begin,
would say
we'll
like
numb the
23,
tooth,
4A,
then shape
4B,
it,
whenever they're doing my
take
teeth.
impressions for our dental lab, place a temporary crown, and determine the shade of the tooth. When our patient returns for their next appointment,
My shade is
we'll
yellow.
place their permanent crown. Now, let's put on our gloves and get down to business. First, place some topical numbing gel on the injection site. This will alleviate any pain or discomfort the needle may cause.
Get out of here, bug. Alright, let's... Why are there bugs in my surgery room? Stop it.
Now we need to inject the local anesthetic. After
More
it has
needles.
taken effect, the area around the tooth and the patient's lower lip should be numb for a few hours. Inject the local anesthetic
Can I
into the
stick it
patient's
right in his-
gums, just
right in
below
his-
the tooth we'll be working on.
Can I stick it right in his mouth? Fine, let's go right in his gums. Why do you have to just jab it. Why can't you just...
Let's wait a few minutes to allow the anesthetic to set in.
Your lip's bruised.
Now that the area has become completely numb, we can move on to preparing the tooth. To begin, we'll reduce the size of the tooth, cutting it away from the adjacent teeth. Go ahead, give it a try.
The hand piece? We're just getting right into this. We're cutting up bones. It sounds like you're just drilling his teeth.
It looks good, but we need to create a more tapered top to the tooth. This will allow for a more comfortable and exact fit for both the temporary and permanent crowns.
Taper the tooth. You're drilling right into his tooth. I don't like the way the tongue moves. It looks too realistic. Your tooth looks like a piece of candy corn now.
Now that the tooth has been shaped, we'll need to take impressions of our patient's teeth. This is done by placing impression trays into the mouth
orange
and
stuff?
having the patient bite down on them. These trays are filled with a putty-like substance that is generally
Bouncy
referred
gel and
to
repulsion
as
gel.
impression material. The
If
impression
anybody plays
material
Portal out
is
there, you'll
used
get
to
it.
create a plaster cast and is then sent to our dental lab, where a dental technician will make the patient's permanent crown.
Am I supposed to just sit there
Go
with...
ahead and make the impressions of
You're
our
just...
patient's teeth. When you're done, I'll have my dental assistant create the
Your
plaster
eyes are,
cast
like,
and send it to the lab,
so brown.
where the magic happens.
Place the impression tray on the patient's upper teeth.
Excellent work.
Okay.
My dental assistant just informed me that our patient would like an all-porcelain crown on the tooth. So before we can finish up with them for the day, we need to determine the shade of porcelain that resembles their natural teeth. Can you handle this?
Okay. They look... somewhere...
Are you colorblind? That doesn't match at all. Try a different shade.
You're just insulting me now! I'm trying my best, man. I have a family at home I need to feed. How about that one?
That looks like a match. The last item on
You just called me
today's agenda
colorblind.
is to place the temporary crown. The temporary crowns that we use are prefabricated and made of plastic. I've already lined the inside of the crown with the temporary cement, so go ahead and place it on the prepared tooth.
Can we put it in your eye as revenge for calling me colorblind? Place the temporary crown on the prepared tooth. Just sits there.
Since it's only a temporary crown, there are some guidelines our patient will need to be aware of before they go. They need to avoid sticky and hard foods. Try not to chew using the temporary crown, and steer clear of flossing on either side of the temporary crown. By flossing around the temporary crown, our patient may unintentionally pull the crown off the tooth. Well, we've done all we can do today. Our patient will need to come back in a week to have their permanent crown placed.
1 week later. What, no jazz music?
Welcome back. Our patient has
Welcome
returned
back.
and is ready to have their permanent
Look at his
crown put
teeth.
on. Begin by using the dental hemostat to remove the
Give me that
temporary
tooth.
crown that we placed on the tooth last week.
The hemostat, those are tongs. Don't try to overcomplicate things.
Now
Oh, the
use
ripping sound is
Explorer
just
to
no.
remove any excess temporary cement and debris.
I've pulled tooth pieces out before, and it's just the sound of the ripping that... Ugh. Use the Explorer to remove... The Explorer. Okay, so use Dora to remove excess temporary cement and debris. Okay. Oh, that's what those things are called? Those pick things. They did that to me and my teeth, too. They were picking at my teeth.
Crown, and everything seems great. I've applied cement on the inside of the crown, so it's ready for you to place.
Place the permanent crown on the repaired tooth.
Perfect.
It's like it was never
After
broken.
the cement has hardened, The dentist would check the fit of the crown again, and the patient's bite.
For 32 easy
ensure that
payments
there
of
are no issues.
$14.99, you too could have a face
Luckily
as
for
pretty as
our
this.
patient, you did a marvelous job. After placing the permanent crown,
Call
our patient may
1-800-BAR
notice
fight
some
today.
mild sensitivity for the first hour. Their dentist will also offer them some post-case recommendations to follow before they leave. This includes waiting at least an hour before having anything to eat or drink, and waiting 24 hours before enjoying their favorite sticky or chewy foods.
So no gum.
If our patient has any pain or sensitivity when they bite down, they should contact their dentist immediately. This may indicate that the crown is too high on the tooth and needs to be adjusted. Most dental crowns last anywhere between 5 and 15 years, depending on normal wear and tear, oral hygiene habits, and other behaviors, such as teeth
grinding your teeth. I
chewing
cannot
ice, or
stand
biting your
when I grind my
fingernails.
teeth.
Well, I hope you've enjoyed placing a dental crown. Maybe you should consider a career in dentistry. While you're at it, check out other great surgeries here at SurgerySquad.com.
Well, we'll have to do some of these other ones a different time, but for now, I've been your dentist. Hope you enjoyed your visit.